Hey Switzerland, how's it going? Still in love with cows?
All right, Somalia. At least my people are not pretending their coastline is a personality.
At least my people don't yodel recreationally.
At least my people are not dying at the average age of 50.
Too far, Swiss.
You're right. I'm sorry. That was messed up.
You know that's my biggest insecurity, and I don't know,
What can I do to help?
all I've ever wanted is for five driven and ambitious students from an accredited university to do a detailed data analysis on predicting life expectancy on a global scale, and help me figure out how to better allocate my resources.
I'll make a call.
Hi, Switzerland. We are Group 21, and our final project is Predicting Life Expectancy, a global analysis of socioeconomic and health factors.
This is our research question, but in short, we sought to find what makes people live longer around the world and what are those factors, figuring out if factors like GDP, education, or vaccine rates affect life expectancy to better guide countries' focuses on public health and policy decisions.
Across our three references, we have learned that developing countries benefit most from healthcare access, and wealthy countries struggle more with lifestyle diseases such as alcoholism. Furthermore, GDP alone doesn't guarantee long life expectancies. Strong healthcare systems and social programs are also highly impactful.
Our main hypothesis is that countries with higher healthcare budgets, higher vaccination rates, and stronger GDP per capita will experience the greatest increases in life expectancy. Conversely, countries with higher average BMI are expected to see lower life expectancy due to lifestyle-related diseases like diabetes and cardiovascular diseases.
Throughout our project, we were careful of ethical concerns. The dataset has collection bias, which could overrepresent wealthier countries. We also consider the risk of stigmatizing populations by linking low life expectancy to factors like low public health spending. We emphasize that correlation does not mean causation, and that our findings should not be used to make individual level or policy decisions without caution.
We analyzed 193 countries between 2000 and 2015 using World Health Organization data with variables including life expectancy, vaccination rates, BMI, disease burden, mortality rates, GDP, healthcare spending, alcohol use, and years of schooling.
To address missing or inconsistent GDP values, we added dataset number 2, which provides GDP per capita for all countries. And we also did box plot and pair plot to orient ourselves with the data shape, spread, and relationships.
We used a correlation matrix to quickly see which variables were closely related or overlapping. To simplify the dataset, we kept diphtheria vaccination rates as a representation of overall vaccinations and under 5 deaths to capture early life mortality, while dropping polio, hepatitis, and infant deaths. This helped reduce redundancy and focus on the most informative values.
We trained the decision tree regression model to predict life expectancy using our clean data set of variables. Excluding country and year, these were removed because they act as proxies for life expectancy and could overshadow the socioeconomic and health indicators that we want the model to learn from. We used the feature importance from the decision tree regressor to see what variables could be strongly impacting life expectancy.
HIV and AIDS is the single strongest factor affecting life expectancy across countries, according to feature importance. Economic factors like how income is distributed and GDP also play a significant role. This means that distribution of resources and overall economic context are important. So, Somalia, your next step should be working towards prioritizing reducing disease burden through better prevention and treatment programs. For example, this can be done through expanding HIV testing and medical coverage. An example of a successful program is Botswana's National HIV and AIDS Treatment Program, which significantly increased life expectancy.
However, it's important not to chase improvements just in target metrics alone. Effective policy must address the underlying health challenges, not just the numbers. Looking ahead, there are a few directions for future research. We could track changes year by year to see trends over time. It would also be useful to study how combinations of factors, like income and healthcare access together, influence life expectancy. Another important step is to look at the differences within countries, not just between them. Our project ultimately helps us understand both how challenges and economic fairness matter when it comes to improving life expectancy.